Hello, welcome to this screencast designed specifically for practice assessors, but also workplace and placement supervisors and trainee nursing associates, assessment guidance for the assessed episode of care undertaken in practice towards the end of year one. This is Rosie Doyle from UEA, and just to remind you that it applies to the September and November 2018 and the February 2019 groups. I hope you will find the next 15 or 16 minutes helpful. So the Year 1 episode of Person-Centred Care, EoC, has been scoped into the Year 1 practice assessment document and is part of the summative assessment of practice, which comprises assessment of the Year 1 competencies. And this episode of patient care feeds into the assessment of the overall competencies. So the trainee nursing associate needs to pass safely this episode of patient care, as well as passing all the competencies required. This slide is pointing to the fact that it's an assessed episode of care for one individual at this point at the end of year one, but it is not just about clinical or technical skills. It is also involving communication and relationship skills. We've had some help and support and some very useful feedback from service users, which has helped us to identify how to simplify this, but how to make sure that the right things are being looked at. The arrow at the bottom of the screen reiterates the key point that it's agreed care for one person in the TNA's workplace. So one person, and agreed, well agreed, wherever possible by seeking consent from the patient, resident, service user, but also agreed with the practice assessor, so it's at a mutually convenient time when the practice assessor can observe the TNA undertaking this care, and the practice assessor is observing and assessing the TNA to make sure that the episode of care meets the required competencies, involves the demonstration of appropriate knowledge, skills and behaviours. So when does it take place? As mentioned earlier, it's part of the end of year assessment for year one. Where possible, it's to take place before the TNA starts placement 2. For the first group, the September group, since they are nearly at that point, there will be some flexibility so long as it takes place before the summative assessment of the practice assessment document for year one is due. And where possible, the TNA with the practice assessor and or the supervisor should have had some practice goes at being assessed in practice, given feedback which are not summative but which help to build up their skills and also give them feedback so that they are learning and growing ready. Yes, the TNA does have to pass this episode of care. It's about fundamental principles of patient care and nursing care. It's about safe care, person-centred care, care tailored to the individual, that's organised and happens in a timely way, and that demonstrates the appropriate professionalism, values and behaviours and attitudes during the episode of care, whilst maintaining dignity and safeguarding the patient, service user, carers and or family. In the PAD, there is no guidance given as to how long the assessment should take. Therefore, the guidance will clarify that it's between 20 and 30 minutes, depending on the care being provided, so it needs to be an appropriate amount of time, with a further 5 minutes for a question and answer session. The 5 minutes enables the practice assessor and the TNA to discuss the evidence base and the justification and explanation of the care provided. At this point, the TNA can share other evidence, which might be from their PAD, from their or ongoing achievement record, from their portfolio. Of course, they may have explained some of this whilst they are actually delivering the care, but it's really important that their knowledge base and their understanding of why the care for this person is delivered in that way and what the evidence is to justify and support this is articulated clearly. So to summarise, between 20 and 30 minutes, the care for one individual with a further 5 minutes for a question and answer session. The episode of care will be mutually agreed with the practice assessor. Not normally comprise providing care for a very complex or unstable or unconscious patient or somebody who is really problematic to care for. This Year 1 assessment is saying, can the TNA deliver fundamental care around some of the key activities of daily living? Complexity will be assessed in the second year of the programme. As mentioned earlier, where possible, the consent of the patient, resident or service user should be gained. If the person isn't able to provide consent, and if they're unconscious, for example, then maybe it's not appropriate for the TNA to be assessed delivering care at this point in their first year of education. In line with the Health Education England curriculum and the NMC standards of proficiency for nursing associates, the care episode will focus on one or more of the following, which map to activities of daily living, and here monitoring of a person's condition, providing support in relation to rest, sleep, comfort, dignified care, personal hygiene, hydration, nutrition, bladder and bowel health and care, mobilising, safety, respiratory care, prevention and management of infection. So the care may comprise several elements of this and the explanation of and demonstration of understanding of why care has been delivered in a particular way and what local policies, national evidence and so on might say. But it's important to also restate that this should include demonstration of appropriate and effective communications and relationship skills with the patient, resident, service user. This was something that our service users, when they looked at this assessment, made clear they wanted us to state clearly, and that is as it should be. Don't forget, the components of valid, i.e. lawful consent, are that it is voluntary, that it is informed, and that the patient or resident has capacity to make the decision and to weigh up and consider the particular decision that they're making. This slide demonstrates the hierarchy, if you like, of performance derived from a model by Bondi, and whilst published quite a long time ago, has been used by the regional and national groups that have been trying to develop very successfully more coherent practice assessment documents to run across the nursing associate and the nursing programs, so that assessors in practice and supervisors in practice don't find themselves looking at a whole host of different practice assessment documents. So if we start at the top at I for independent, the practice assessor may find that the trainee nursing associate is really safe, accurate, systematic, coordinated, and is able to independently provide good care with very little need for prompts or guiding cues. At this point, the practice assessor may offer some help if asked for, but will generally not intervene and will act as an observer. S for supervised. This case is quite clearly a satisfactory, safe performance, but perhaps needing somewhat more guidance and prompts than a TNA who is fully independent. A is for assisted, so safe and accurate, appropriate care, but needing quite a lot of prompting, and maybe not as coordinated and perhaps a bit more muddled or slower than might be optimum. M is marginal, so can be safe but needs lots of guiding cues in order to remain safe. And D is dependent, can't demonstrate safe practice, knowledge base is not adequate, professional behaviour is not as would be expected. So to further clarify that, you could see that taking the independent, supervised and so on, we're given a little bit more information about the standard of the procedure, the quality of performance, how much assistance, and you can see that a TNA who's meeting most, if not all, of the criteria for independent is achieving a safe care and showing excellent care. Supervised, very good care, but again there's a few more cues as to what the particular facets of the procedure and performance are, and demonstrating that it is perhaps not quite as independent as independent marking is. This should help you as a body of practice assessors to be a bit more consistent in approach towards TNA assessment, which I know can be problematic with so many people involved, but which trainees quite rightly see as needing to have more consistency and fairness of approach. On this slide you can see that we're an amber for assisted. Yes, the performance is safe. Take time to look at some of the criteria and you can see again that frequent cues, being more directed, not necessarily very confident, but is safe but with room for improvement. So whether somebody is excellent, very good, safe but has room for development, the feedback that they get about what has worked, what could be developed further and what to do to become even more effective in future is really important to them. Then we've got the red for marginal and dependent. This shows when a TNA is not meeting the required standard. So they have a need for very clear feedback and an action plan ahead of a re-attempt at this summative assessment after a period of coaching and support. So all TNAs need good feedback, and hopefully the grid on these two slides, coupled with the longer, more detailed guidance that will be issued, will help you as practice assessors and help TNAs to understand why a particular level has been met and what could be developed further, or what was good about the performance. The assessor's role is as an observer, may offer some guiding cues, but is not there to lead the TNA. However, the assessor will intervene if at any time they observe any unsafe practice, and the assessment must be stopped if at any time unsafe practice is observed. If something happens in between, say a fire alarm goes or some emergency, the assessment may be stopped and then restarted later. This slide is a screenshot of the information that's currently in the pad that shows which domains and competencies. So there are 8 mapped in against this assessed episode of care: professional values, person-centered approach, actually delivering clinical and care skills at an appropriate level for a first year TNA, communication and interpersonal skills, duty of care, candour, openness, honesty, team working and leadership, and research development and innovation, which is why teasing out the evidence base underpinning care and the TNA's knowledge about the rationale for care is really important. Here the practice assessor marks whether each of these domains or competencies has been met. Yes for pass, no for fail. Space for qualitative feedback, which could be expanded on separate pages, and in the case of a fail there is an action plan template that is to be completed so that it is clear what needs to happen to ensure that the TNA is in a better position when the resit of this episode of care takes place. Feedback, as I said earlier, is absolutely vital. Whether the TNA has done excellently and is an impressive, compassionate and proactive practitioner, or whether there's much room for improvement. It's really important not to only think that those people who are not doing well needs feedback. And hopefully the feedback will also feed into what we call feed forward, which is advice, ideas of how to continue to perform well or how to develop in future so that future care, not just future assessments, are as effective as possible. Okay, good luck to you as practice assessors and your TNAs. I hope this has been helpful.